CEO of iHasMD. Krishna, thank you.
Thank you. First of all, before I begin with my slides, I'll take a little bit of deviation before I go into the slides and talk about a couple of things that I observed this morning in some of the presentations and also presentations here this afternoon. And then maybe ask a question to the audience, and then I'll go into the presentation. Talking about the low-cost healthcare delivery, cost is missing from my title. What do you think is the most effective low-cost medicine that we can deliver in any country? Forget about, I have been hearing probably 10 times today. I heard developing, emerging, developed. Does healthcare anything to do with those labels? Those labels were given a long time back. I would call them all stupid labels. I think we should forget about those labels. We should think totally different. Good example is Switzerland, so-called developed nation. If they open up their bank accounts, probably the poorest nation in the world, right? So let's not worry about those labels. But talking about low cost, what do you think is the most effective low-cost healthcare model that we can come out with? Anybody?
Not getting sick.
Stop eating what is being served in a workplace. For example, if you don't eat the food that is being served in this hotel for next 3 days, you will live probably 3 days more. Very poor health, in terms of health point of view, very poor quality food that is being served at the hotel today, what I observed. So, as Girish Rao was mentioning this morning, one of the employer, when they did the survey, which is not surprising that the youngest population of the country, in this country, 35 years, 40 years under, very poor quality health. I can tell you, my father, who is very close to 90 years, much more cost effective for the system than a lot of young people probably in this room. Because the kind of poor quality food that we eat, the behavioral changes that we have today, probably telemedicine is bad for our health, because not only whatever little walking you're doing, little effort you're putting to go to health center, you'll be stopped doing that. Because I think this morning somebody was showing TVs, 1990 versus 2000, with a remote versus no remote. When there is no remote, we are doing little more steps. With the remote, we are becoming a couch potatoes. I think that is the problem with healthcare. Not the technology, not anything else. I think we have to change our behavior. Again, I didn't have enough time because I was given this topic just 3-4 days back. But I had some slides I wish I included. One of the surveys that came out this year, early this year, was from the Princeton survey. A lot of employers was asked, what is your biggest challenge providing healthcare to your employees? Number one answer, 67% of the companies said, is the behavior of the employees. It's not just developed or developing country. Every country that you see, I'm sure you'll see same answer across the board. I think that's what we need to focus on. And with that, this is actually a quote came from Jonathan Linkos from American Telemedicine Association earlier this year. He said, technology enables telemedicine. But telemedicine is not about technology. I think that's what we all need to understand, what telemedicine is about. Telemedicine is about delivering healthcare. It's not about technology. And I think last two presentations actually talks about that. Again, this is just a small surveys coming from Princeton survey, talking about what are the biggest challenges for the country. Number one challenge, a lot of countries said, this came from about 96 countries, providing equitable healthcare services, and I think that's what we heard in last 3-4 presentations this afternoon. And another is about the maldistribution of healthcare professionals. And I think I'm very surprised to see some of the numbers from India. 2% of the doctors actually are in the rural area, where 70% of the population is. And it's even worse than some of the other countries in the other parts of the world. So what is the answer? How do we solve some of these issues? Is developing another piece of equipment? I think we have enough technology. I don't think we need to develop again and again different technologies, different pieces of things. Another approach, many times people make a mistake, is let's subsidize healthcare. And is that the real answer? Or utilizing or coming out with the better delivery models is the better answer. Here is an example from the US. 12% of the emergency department visits are actually going to hospital admissions. What happens to the rest of the 88%? Probably they are unnecessary ER visits, emergency room visits. What it means is we are not utilizing the resources more efficiently, more effectively. That's what I think the problem is. That's where probably the technologies can help us solve some of those inefficiencies, probably coming with the better delivery models. Here is another example. Primary care office visits in the US, about 580 office visits, primary care office visits per year in the country. Interestingly, cost of those primary care visits, only 4% of the total cost of healthcare in the US. What it means is the cost of primary care is so low, but at the same time we have number of models today showing primary care actually is the answer for healthcare problems that we see anywhere, not only just in US, UK and so on. Even in India probably even more acute in terms of primary care delivery. Do we actually have a primary care delivery? Probably not. That's where I think efforts needs to be put so that we can solve the healthcare problem. So one of the things I heard this morning was, or this afternoon was, probably RMPs, which I think I come from a village in India as well. I was born in a village, and RMPs are the answer to the healthcare in the villages even today. And if we complain that RMPs are not getting the right training with the delivering today's healthcare, maybe that's where we need to focus. Maybe that's where the governmental agencies, both private and public, should focus on providing the right training to those some of those healthcare workers, community healthcare workers, RMPs, whatever we call it. So here is an example of primary care delivery model, actually very widely reported, widely studied primary healthcare delivery model from the VA, which provides about 25 million healthcare to about 25 million veterans in the United States, and probably this is the largest model that is out there, clearly showing primary care model actually reduces the overall cost. As you can see, this is a chronic disease population, CHF population, congestive heart failure population. Total cost of delivery before the home care primary care model, about $40,000. And after implementing that, the cost was reduced by 25%. You can imagine, again, as you know, the total cost of healthcare is mostly for the chronic disease population. 80% of the cost is for the 20% of the population. Right? So if we can save 25% of the 80% of the cost, which we are talking about close to $1 trillion savings for the United States, as an example. So what I'm trying to say is, the primary care we can focus on, again, one of the issues we have in the primary care is, the primary care model that we have seen from the VA is sending the nurses to the patient home, sending the primary care physician to the nursing homes. And that's not possible because we already have a shortage of doctors. We already have a shortage of healthcare workers. How do we solve that? That's where I think we can bring in two ways we can solve that problem. One is improving the efficiency of these healthcare workers, either primary care physicians or the nurses and so on, where we could actually eliminate some of the office visits by bringing technology in place of that, so where we can say 30% of the time for the primary care physicians. And again, so what I'm this one I use a number of times, what we call the perfect storm. Healthcare is actually, we are in the perfect storm, whether India or Europe or US, because rising costs, higher demand for the improved care, because people, as they get more educated, they are demanding for better care. Shortage of physicians is a bigger issue, and the physicians are kind of squeezed, or the healthcare operations are squeezed with less and less payment. So that's why we call it a perfect storm. And what is the answer? The answer is technology, as I said, mentioned before, or is it telehealth, telemedicine? What is the answer? So I think, one of the things we take the approach is radical and innovative approach, where we bring the analytics, we bring the high touch. What we call it is high touch, where we can bring in more primary care workers, whether it's physicians, nurses, to aid these patients at home, and innovative technology, appropriate technology. And one of the things, I'm going to skip all these slides, but this may be an interesting slide for some of you. As you can see here, again, this is a workplace, employee population in a workplace, where you can see problem with that population is 23% of the population is the problem. If we can focus on that population, probably we can utilize the resources in better way. So we developed a platform to deliver some of these ideas, and I'll just to give you an idea, this is an integrated healthcare platform where we can not only provide real-time audio-video visits, but also integrate some of the clinical information within the same time, in real time, so that the system becomes physician or a healthcare worker friendly, where you could do the documentation same time, the physician, the nurse, the patient, everybody can see same information, so that the patient becomes more comfortable making that visit. What we call it is emulating in-office visit. That's basically what we are doing. By bringing technology so that we can improve the efficiency of the doctor, the efficiency of the nurse or the healthcare worker, and making it simple. If it is not simple, healthcare workers are not going to use the technology. Again, we talked about who is the real barrier for telehealth. It's not the patient, as I think this morning somebody was mentioning. It is the physicians who are the barrier for the telehealth. If we can make it simple for them, make it easy for them, I think we can bring the technology to the telehealth to the mainstream. So with that, again, you can see a number of published, information about how telehealth can solve some of the problems and so on. I'm going to skip all this. With that, basically what I'm saying is two things I wanted to just basically bring to your attention. One is, in order to solve healthcare problems, in order to bring the low-cost healthcare delivery, if we can focus on efficiencies of the healthcare workers, including physicians, and focus on changing the behavior of the population, I think we can really effectively deliver the healthcare. Thank you.
Okay, thank you.